My name is Don. I have COPD with fibrosis, scarring of the lung tissue. Well, right before, a couple months, maybe 3-4 months before treatment, I couldn't get out of bed and was on air 24/7. And I had the stem cell treatment, and it was about 2.5 months, I started feeling better and eliminating the air a little more, and then it got to where I was eliminating the air completely. My life has been a lot better. I look forward to this next treatment, and I'm doing good at 3 months, and I want to see what I'm going to do at 6 months. And with another stem cell treatment, I should be very good. But I did construction work with dust all my life, along with smoking, and you know, my lungs are pretty bad. You know, all that drywall dust in my lungs for years, and for this to happen, it's great. I went to the Cleveland Clinic, and the Cleveland Clinic was talking about putting me on lung replacement. And I got on the computer, and I got to looking around, and I went, wait a minute, there's a 5-year average per average person life expectancy after a lung transplant. And I'm going, now you gotta go on the medicine so you don't reject the lung. I said, that's a year. I said, you gotta heal from the where you're cut open, with for the lung transplant. And I said, wait a minute, that's only gonna give me 3.5 years, maybe. I said, that's not worth it, and go through the pain of the surgery, the pain of, you know, staying in the house, because you can't go out. If you get an infection, you die with a lung transplant. I did a lot of reading on that. That's just not worth it, you know. And this right here, I advise people to do this because it's too many people go that way, and if they can go this way, that's the way to go. My wife was very skeptical at first, and she sees what it's doing now, and she goes, wow. You know, which, you know, I mean, there's a lot of things out there that don't work, and when, you know, and for the money that's paid, it's like, wait a minute, is it gonna, if it don't work, that's a lot of money, you know. So, no, it's worth the money. Quality of life's got a lot better, and I look forward to get better. My pulmonary function, I was 30%, and now I'm 34% in 3 months, which the Pittsburgh Lung Institute, they were amazed at how they said, we don't see this till 6 months. And I was amazed, you know, but I was amazed at what happened, that I could breathe, you know, that I didn't have to have that air, you know. If they want a better quality of life, I recommend anybody that's having a little bit of problems to do it. I mean, I was severe, and I am severe. I mean, 30 years of drywall dust in my lungs. It's like a coal miner's white lung, you know, and that's no good. And for something like this to help, oof, that's, you know, like I said, some people just have lung problems, and they're not as severe. And if they're that way, I mean, what it did for me, they'll be really, really good.